And it is my pleasure to introduce Paige Nolt, who is a licensed clinical social worker here in Charlottesville. She has a passion for working with clients who have experienced trauma, anxiety, and depression. And she, for the past 8 years, has been a big asset to CASA. So without any further ado, I'm going to turn it over to Paige to present today. We will be having an opportunity for questions at the end. There have been a handful that have been presented earlier to us from a handful of you have submitted email questions. We will have to be out of here by 11 o'clock as Paige has a client coming in at 11. So hopefully this will be short, sweet, and impactful for everybody in the room. So Paige, the room is yours.
Good morning, everybody. Let me go ahead and share my screen. I have kind of a small PowerPoint that I've put together, and we will jump into this today. This little meme has become my favorite for 2020, now into 2021, where it really feels like we are all just sitting in the midst of a burning down building saying, and we're fine, everything's good, let's just keep going. So when I was thinking about putting the presentation together this morning, this was the image that came to mind. I was like, I have to put this up here. So everything I'm going to be talking about today is kind of, from my perspective, what I'm seeing, what I'm noticing in my practice, and then also from just conversations with my fellow clinicians and understanding where they're at and what they're struggling with as well. And we'll have an opportunity for some questions, but I'm going to kind of go into some depths about what we're seeing in our community and mental health and kind of the Charlottesville area. And hopefully this will be useful for you guys as you kind of go out into the world and the community and interact with other people. So the first thing I wanted to kind of talk about was like, what did the landscape of mental health look like pre-pandemic? And what we all knew and experienced was waiting lists. I would oftentimes get phone calls from people who had called 9, 10, 12 providers, sometimes not even getting phone calls back, not ever able to find anybody who was either taking their insurance or had room for new clients. There was oftentimes long waiting lists to see providers even before the pandemic, and particularly for anyone that had Medicaid. Medicaid was becoming increasingly hard to find available providers that took Medicaid. So this was existing pre-pandemic time as well. The time and the money. So therapy is at minimum once a week for an hour type of service. And that's typically how you want to start off therapy, to get traction, to kind of build rapport and establish safety in the relationship. Some clients were coming twice a week, kind of depending on what was going on in their world. That takes a lot of time away from work, time to kind of build out into your schedule. Not to mention copays, deductibles. We have seen over the last several years just a super increase in deductibles and copays. And depending on what type of insurance you would have would depend whether or not they would classify someone like me as a specialist or somebody like me as a general practitioner, and that could change your copay. And oftentimes for people, $50, $75 a week copay was just outside of their budget area. And that was always a huge consideration as well. Access to the service was an issue pre-pandemic. Charlottesville is really fortunate in that we have a ton of therapists, which is great. The downside to that is if you live in any of the surrounding counties, your options for available therapists are decreased significantly. And then you talk about long drives to get, 40, sometimes people were driving 40, 45 minutes one way to get to see a therapist each week. And that eats into gas money, into time. And specifically for the lower income population, anyone with Medicaid, transportation, gas money, and time is not a luxury they often had. And Medicaid's solution to that was always, we'll use the Medicaid cab. And if anybody has ever known anybody who's ever tried to use the Medicaid cab, that service is impossible. It's either not available, they show up late, they arrive early. Clients are sitting in the office for hours waiting to get into their appointment because the Medicaid cab dropped them off 2 hours early. It wasn't really a useful service before the pandemic as well. So what are we seeing during the pandemic? So what happened for a lot of our mental health professionals was that when the shutdown happened in 2020, we moved all of our clients to teletherapy. This was not an easy shift for the therapists in the world, as well as for our clients. And some of our clients shifted easier than others. But I know for me as a therapist, a lot of the work that I was doing was, the relational piece of things. You can't read the body energy off of somebody. The signs and things I would look for in the room, shift in the way they were breathing, the tapping of the foot, signs that I would look for that someone was experiencing some level of emotional distress or something was happening in the space, I could no longer see. And the shift to telehealth, taking my entire caseload and moving it to the computer, presented a problem for a lot of therapists. We spent months and months and months trying to figure out, how do we do this in any kind of real way over teletherapy? And we're still figuring that out. There's been a lot of great resources developed and becoming available for folks to use. And luckily in the Charlottesville community, there was a lot of collaboration and people sending out resources and information about how we translate this, but it was a huge shift. And with our clients, what I've noticed is that there's been some people who shifted and really liked the teletherapy really well. I have clients that show up and, they have their warm blankets with them for comfort, or, the pets that are showing up in therapy are so sweet. Cats kind of scrawling across the front of the computer screen, or the dog laying on the lap while they're crying and doing the really hard work. And for people who feel safe at home, this is actually allowing them to tap into some harder emotions because they're in their space, they're in their comfort zone. They may have their pet with them, or, a family member or a partner who's loving and caring there that helps them feel safer. And the transition wasn't necessarily as hard for those folks. The other side to the cons part of that is, again, access. And, internet access is difficult. I live out in Scottsville, and my internet access can be shoddy on a good day. And thinking about my clients and their ability to have internet access, switching to telehealth greatly shifted that as well. I know for some folks, it was a deal breaker. They just couldn't do it. And I've tried to do some phone therapy with some people who the teletherapy wasn't working, and that just became more difficult for them as well. And so it really shifted a lot for some people based off of their access to internet and their ability to do the teletherapy. For children, it had been really hard too. This was a huge shift for everybody, but therapy over teletherapy for younger kids has become almost impossible. I would say for me, I feel like the cutoff age is right around 11 or 12, depending on the kid's emotional ability and their, their maturity level or where they're at cognitively. I am not currently seeing any small children in my practice because they just could not hang with me and do the therapy over the teletherapy. There are some clinicians in the community that are still seeing young children through teletherapy. I think a lot of that is being shifted the focus to the parents and helping the parents manage the children and their behaviors. And there's a couple of clinicians in the community that are still seeing clients in person. That's kind of fairly limited and not necessarily happening on the same level that it was before. And then safety. If we have clients that live in a home that is, chaotic or unsafe, or there's, substance abuse going in the home, that greatly hinders their ability to do therapy via telehealth. And it's interesting because, we get this really nice window into someone's home and their environment through teletherapy that we didn't have before. And that can be really informative of, well, that makes sense that the child is struggling that way, or it makes sense that this person is having a hard time, just by kind of seeing how things at home are structured. And I know this is impacting people in teletherapy. I know it's impacting kids in school. The environment at home can either work for you or against you in some of these cases. And because we've been in this for so long, I know there's this huge swath of kids that it just isn't working for. So during the pandemic, waitlists. So what it was interesting was at the start of the shutdown, in the beginning of kind of everything going to a different pace, we actually saw wait lists decrease. We saw, before the pandemic, wait lists were astronomical. People couldn't keep up with them. As soon as I would have a spot open, it would fill instantaneously. Right around the beginning of the pandemic, we saw a drop off of that. And it felt like the calm before the storm, like knowing that, like, okay, this is not how things were before. We'll see when things start to creep back up. Well, we're there. The wait lists again are just astronomical and long. I know folks are really trying to find that balance between how much clients they can see. Teletherapy is exhausting in its own way, and I think that sometimes is limiting how many clients people are seeing. Those wait lists are back up again. Again, the time and money part of things. Right at the beginning of the shutdown and the pandemic, we saw a lot of the insurance companies waive any kind of cost sharing. So there were no deductibles, no co-pays. Therapy was being covered at 100% at the beginning part of the pandemic, which I was super excited about. I was like, yes, anyone who needs therapy, go get it now. Wait lists are low and it's not going to cost you any money. Like, get in there. And that has started to go away as well. As far as I'm aware, currently, Optima is the only insurance company still offering no cost telehealth services. That's both medical and mental health. But every other major health provider in the area, Aetna and Anthem, have returned back to deductibles and copays. And so there was this brief window of time we had where accessibility was really opened up, and that has started to slowly close down again. So testing, any kind of academic or psychological testing that we would do for kids or families, those were all developed and designed to be in-person testing. And what we've noticed over the course of the pandemic is really trying to rethink how testing gets done. And some of the academic or psychological testing that was being done before is being done in what's called a provisional way now, meaning that they will administer 90% of the test that they can administer and give you a provisional diagnosis of whatever they think it is, but it can't actually be a full, complete diagnosis because the segment of the test that has to be done in person cannot be done via telehealth. I think there is some movement amongst people that develop the testing to shift and change some of that to respond to the pandemic, but that has been severely limited as well. And then some of our more intensive services in mental health, such as the in-home and then hospitalizations, we've seen a huge shift and change as to what that looked like. At the beginning of the shutdown with the pandemic, I think in-home services were greatly reduced or even went to even virtual. And it's been over the course of the last several months that folks have started to open that up. But even that doesn't look like what it used to. Mask wearing and social distancing, and some clinicians not feeling comfortable going into the home. So doing things outside when the weather would permit. That kind of service that was really intensive has started to shift and change during the pandemic as well. And typically in-home services are reserved for our most vulnerable families and kids that are really in need. So that kind of was shifted and changed and still kind of evolving, and how can we do that safely with everybody? As well as mental health hospitalizations. There was always kind of a difficulty, particularly in our area with mental health hospitalizations, especially for children, because there is no mental health hospital for children in this area. Children were always having to be sent outside of our community to receive mental health hospitalizations, heading to Richmond or to Roanoke and to different parts of the state to get to mental health hospitalizations before COVID. In COVID, that has been made even increasingly difficult. You have to have your COVID test done, and oftentimes there is isolation at the beginning of the hospital stay until they can get the negative test result back. So the beginning part of hospital stays, you're not being immersed into the therapeutic setting the way you were before, with groups and individual type therapy. And depending on who you get roommated with and isolated with, that can be really difficult and exacerbate mental health symptoms instead of going to the hospital to get stabilized. We're seeing long wait lists and unavailable beds for the hospitalizations as well. The mental health symptoms, you name it, we're seeing it. I think for me, I knew this was coming. I think a lot of people went into survival mode. I know I did, where, the school shut down and, people were remote working from home and restaurants were shut down, and all these things that we, maybe weren't fully aware of how important all those were to us really got taken away from us. And I think a lot of people went into survival mode, which is probably why we experienced the decrease in the wait list at first, is that we were just all trying to figure things out, and mental health became a back burner issue. I was doing some research and looking into some studies that were being done, and all the research and studies about the mental health about this pandemic are kind of ongoing and not complete. So we really won't fully know the scope of this until a later date. But there was this one study that I read where they did a survey of people in March and asked at that time what impact on their mental health had during the pandemic. And at that time, 32% of the respondents said that there was a negative impact on their mental health in March of 2020. They resurveyed the same group of people in July of 2020, and that number went up to 53%. So what we're seeing with the pandemic is that there was an initial kind of survival, maybe honeymoon phase of things slowing down. And that as this has continued and trickled on and gone on and on, these numbers of the impact on your mental health has just steadily increased. And if we surveyed those same people now, I would anticipate that number to be way higher than 53%. We're seeing, the anxiety, the depression, in particular for my kids that are in school, exhaustion and motivation. Even kids who really liked school or were really successful academically, they're struggling. They're struggling with concentration, motivation. There's, feeling like they don't have access to the teacher in the same way that they did before. Just kind of feeling overwhelmed and not able to be as successful as they were before. For kids in particular that struggled with school prior to the pandemic, I think those kids may have even be dropping out, and they're not being seen. They're not necessarily showing up to class, or, they're doing the bare minimum, but not necessarily learning or growing at the same pace as other kids. Exhausted parents. I don't know about anybody in this room that's a parent, but I am not meant to be my son's teacher, and it was not great, and it didn't go well. And it's exhausting. And so the parents may be coming home from work and then having to help their kids catch up on their schoolwork that their kids didn't do during the day. It's creating an intense pressure system within the family system to try to manage this on your own and in isolation. Increased substance abuse, increased issues, stress within the family and domestic violence, all the things that are coming out of this kind of pressure cooker we're seeing. Isolation and separation anxiety. I anticipate this a lot, especially for younger kids, that as we start to open things back up and when we ask our kids to go back out into the world, we'll definitely start seeing and have started seeing increased separation anxiety in the younger population. And sometimes even in my high school students that I'm working with, there's this huge fear about going back out into the world again that has really shown up for kids and adults. I mean, I think we're all not immune to this. This is kind of across the board. Everyone is feeling this. I would also say that in the same research that I was reading about the surveying people and their understanding of their mental health, this burden of the pandemic is being shouldered a lot more by our lower income social economic status population, that they are reporting significantly higher levels of negative impact on their mental health. And that is also the same population of folks who have problems accessing mental health services. And so that kind of widening of that gap feels like it's just going to continue to get bigger and bigger. And in the mental health field, we are talking about this amongst each other about the pandemic and the pandemic, which is the impact of this on mental health. I know recently the Association of Pediatric Providers came out and said we have to get kids back into school. Like we have to, like there's a recognition that like, yes, we have to do physical safety, but an understanding kind of emerging about what are we doing mental health wise and how is this going to be the long term. And what we're seeing is all that stuff on the surface we know about. We're seeing the anxiety, we're seeing the depression. We kind of predicted those things would happen as we went into this pandemic. But what we're not seeing is all the other things that are going on behind the scenes. Kids are not interacting with typical reporters. So not going to school, maybe not going to daycare, maybe not participating in sports like they were before, which means adults that they would normally notice or see a problem aren't seeing it anymore. So if there's abuse or neglect going on in the home, typically teachers and coaches and outside professionals are oftentimes the people who report those things. We're not seeing that right now. Those kids are kind of isolated and in their homes and not interacting with those typical reporters. The kids that aren't showing up in community events or in schools, or families that are kind of maybe more isolated, either demographically or socially, we're not seeing what's going on with them and their mental health and what's going on in their homes. It was also interesting to see that like when the pandemic first happened, a lot of agencies that work with intimate partner violence anticipated kind of a huge explosion in phone calls as we kind of isolate and put pressure economically and socially on these families. We increase substance abuse, the increase in intimate partner violence is directly correlated to those things. But a lot of agencies that serve folks in intimate partner violence situations saw a huge decrease in people reaching out to their services. And when they looked behind those numbers and started to try to figure out, okay, that didn't go what we thought happened, is this realization that victims are now trapped at home with their abusers and unable to safely access services like they used to. So a lot of the intimate partner violence agencies have fail-safe systems in the computer. So if I'm on the website for a domestic violence partnership website and my partner comes home from work early, I click on a button, the website disappears and gets deleted from your history. But what if your partner's not leaving anymore and not going to work like they used to? And there really isn't a safe space to even start to research what's available to you or to make a phone call and feel like you have privacy to talk to somebody about that help. The substance abuse, we know that that is increasing at home as well and going on for so many people. As a way maybe to cope with stress, maybe a way to kind of manage some of the things that are going on in the home. And when I was researching and going through all the studies about this, the question mark for all of us is, what is this iceberg under the water? We have some ideas and some suspicions about what might be going on that we're not currently seeing, but all the research is saying kind of to be determined. It will take probably years maybe even longer before we really have a good understanding about what happened. And again, that gap just kind of widening academically, socially, emotionally. Um, those who have the resources and the ability to manage this will be able to kind of weather this in a different way than folks who don't. And, you know, we've talked about it amongst ourselves in the mental health field that when schools open up, all of these mental health problems are coming back into this classroom. And what will be the impact of that on teachers and education and other kids in the classroom? So I think there's a real understanding that we need to understand what's happening. We need to be prepared for it. We need to, you know, be taking this pandemic within the pandemic as seriously as we are the physical health, knowing that this is coming. If it's already kind of starting to be seen, but we know that it's coming and there's more that we don't know that is there. All right, so provider burnout. I love this picture. I think as a mental health provider, I had really done a great job in my career of creating self-care and boundaries and making sure that I was really aware of where my limits were and how much I can hold and contain. And then the pandemic hit and that all got blown out the water. You know, I was now having to manage things at home and my clients' mental health, as well as my time schedule, my limitations. And that just put me into survival mode. And I know for my fellow clinicians and practitioners, we're talking about this all the time. We are being pulled on and drained in a way that we have not experienced before. I think a lot of therapists who've been in this field, particularly therapists that work specifically in trauma, as I do, had really developed kind of a sense of how we take care of ourselves. And that wasn't working anymore. And so some of the things that we're seeing as mental health providers is what's known as emotion contagion or secondary traumatic stress. And this is where you are dealing with the same thing that your client is dealing with, the emotion contagion piece of things. We're dealing with all the same levels of stress emotionally, socioeconomic, family pressures, all of this too. And as we're hearing other people unload that onto us, it is overwhelming and triggering and taking our emotional well-being and making it harder to hold that space. Oftentimes therapists that work with trauma patients in particular are really aware of what's known as secondary traumatic stress. And this is where, as a therapist that intentionally walks into the trauma space, you can develop PTSD simply from being in the presence in the space of somebody who has PTSD. You can start to absorb those symptoms as well. And there was a lot of trainings and a lot of research about how to, you know, manage that and prevent that and seek guidance and support from your fellow therapists. And we would have, you know, in-person trainings and support groups that we would all kind of engage and use to help manage that pre-pandemic. Post-pandemic, so much of that has been become a luxury in the therapy world, because when I'm not with clients, I then have to manage all these other things at home that I wasn't having to manage anymore. And I was just talking with a coworker of mine the other week, and she was saying in the midst of tears, she is so overwhelmed, she can't even talk about it. And I just was sitting there with her, feeling her pain with this. And my first thought was, if you're so overwhelmed, you can't even talk about it, how do you sit in a room with somebody else that is so overwhelmed they need to talk about it? I was in a training a couple of months ago, and in the specific type of therapy that typically I love, and it's so inspirational, and I love going to these trainings, and I was super excited to dive into this training. And I'm sitting in this training with this wonderful presenter, and we're doing this really cool work together. And I just am becoming so aware of how much in survival mode I am. And a friend of mine texted me and she was like, what do you think of this training? And I just said, I feel how disconnected I am from my own emotions, that I'm having such a hard time doing this training. And it really kicked off the thought for myself as like, how deep in survival mode am I? And how is that showing up in my therapy sessions with my clients? And if I know I'm in it, I know all my fellow clinicians are in it too. And so we are trying to show up and be connected and manage and help people with their own mental health while we're struggling with it ourselves. It's been quite an interesting challenge. I would say I'm particularly lucky. I think there's a good group of clinicians in Charlottesville that try to support each other and reach out and provide resources and space for that to happen. It just isn't as organic or as connected as it used to be. All right, so that's kind of the overview of that. And when I was kind of practicing this through in my head, I kind of had this idea. It was like a little bit doom and gloom. So I know there's some questions that Randy has that hopefully I could bring some hope and some inspiration about how we manage that through answering some of these questions.
Yeah, and I want to thank Almanita Graves. I see you here in the room. She had emailed early this morning some questions that she had for the presentation. One of her questions was, what is the best way to support young children and teens as they work through the changes resulting from the pandemic? And she highlights online school, less contact with friends, having to wear a mask everywhere they go. So how advice on how to support young children and teens as they work through the changes?
So my overarching message for this is don't silver line a dark cloud. I think as a caregiver myself, a parent, there's this instinct to try to go in and make things better and to kind of point out like, okay, but we're able to do this or we're able to do that. And I think what that ends up doing is dismissing the emotional experience of that child or that teen. Even in the best of circumstances, life is just infinitely harder now than it was before. And so for young kids and for teens in particular, I'm just giving them a space for it to be real. And I notice for some of my my teenagers too, there's this battle that's taking place for them where it's almost hard for them to admit that this is hard for them in a way where some of my teenagers I work with that are academically higher functioning really are putting so much pressure on themselves. Like, I should be able to do this the way that I did last year. I should be getting A's the way that I was getting last year. There's this large resistance to like, this is actually impacting them that I'm noticing. And so I'm trying to make space for like, yeah, we're all feeling this. Like, this is normal. Now, this is an appropriate response to the heaviness of what we're going through. And I was surprised with this with my own son too. We worked really hard to buffer him as much as we could from the hardship of all of this. And, he comes out with things about like, how horrible this has been and, wanting this pandemic to go away and, playing with toys and just bashing coronavirus with his toys. You want to make space for that. We really want our kids to be able to fully experience these feelings and to feel the heaviness of how hard this is in an honest and safe and connected way. And on the reverse side of that, I encourage caregiver and parents to be honest about it too, so that we're not showing up like, yeah, like the picture at the beginning of the pandemic, like at the slide, we're not just like, yeah, everything's great, guys. Like, I don't understand why you're struggling. We want our kids to know like we feel it too. And this is really hard. And the best thing we could do is make a space where we can be mad and sad or frustrated together and really give our kids a space where they don't have to show up as if everything's okay. Like, this is not the new normal. This is really hard. And in doing that, we're not fixing anything, except we're not either giving them the message that they should show up a certain way. And then we're also not giving them the message that there's something wrong with them that they can't show up a certain way. So I'm working constantly to normalize all of those symptoms I showed as real, natural, normal responses to the stressor that we're in. And I really encourage families and parents and caregivers to be vulnerable sometimes too about how you're struggling with it. And let your kids or the kids that you're around know that like what they're feeling is natural and normal too. And having a space to do that really can help them feel less like there's something wrong with them and more like, oh, okay, great. Like we're all in this. Yeah, okay, there isn't something wrong with me.
You had touched on this one a little bit in your last question, but in our webinar today, we're filled with not only parents, foster parents, providers. What are some specific signs and symptoms to keep an eye out, especially when you suspect someone's mental health has been affected?
Yeah. So what I'm seeing a lot of is just a changes in motivation or changes um, in how they would normally function or engage kind of with others in the world. So if you have a kid who is typically more outgoing or seems kind of more upbeat, and you're noticing them spending a lot of time in their room, or changes in kind of sleeping patterns or changes in the way that they're eating either more or less, changes in the way that they are managing their own frustrations or emotions. Maybe you had a kid that struggled with anxiety before. This has exasperated anxious souls in the world to just the nth degree. And so even if maybe they're not outwardly showing signs of anxiety, you want to check in with those kids and those teens or anybody really that you knew was kind of anxious before, because this has made that so much harder for them. I know for just talking to fellow parents, there's a lot of fear our kids have absorbed about going out into the world, fear about hugging other kids, being around other kids, fear about being away from their parents, especially if they have a loving, supportive home. There's even a bigger fear about kind of leaving that and this kind of invisible enemy that we're fighting now. I think with a lot of kids, you're seeing resistance to school and classes and not wanting to show up. Particularly with adolescents, you'll see depression show up as irritability. I have so many teenagers that show up into my office because they're angry or they're irritable or they're yelling at their parents or refusing to do work or whatever the situation might be. And outwardly that looks like anger, but oftentimes it's misdiagnosed because depression in teenagers and in adults can show up as irritability instead of sadness like we would typically see. Any shifts or changes that you see in the people around you could potentially be a sign of how they're struggling internally. It doesn't necessarily have to mean there's a major emotional or mental health problem emerging, but it does mean that something is going on for that person, that they're struggling in a way that maybe they do need a little extra support right now.
Thank you. So here's maybe a little bit of a curveball question, but you identified that there are signs and symptoms, withdrawal or acting differently. Advice to maybe a parent, a caregiver on how to approach a conversation on quote unquote getting somebody help. I think it's easier to reach somebody who says, you know what, I am really struggling with everything going on with me. I'm ready to come meet with you virtually or come sit on the couch in your office and talk about things. But how could a parent or a friend broach that conversation with somebody? Or if there's resistance, how do you engage them in therapy?
Yeah, so this comes up a lot. It was actually an issue pre-pandemic and it's an issue now as well. And it feels like by the time, they trickle into me, there's been some recognition that like, okay, maybe something isn't going so well. And so what I've seen during the pandemic is maybe a longer period of time of which somebody is struggling before it tips the scale for them to feel like, okay, I'm ready to kind of come in and maybe dip my toe in the water. One of the first questions I always ask is, who made you come today? I asked it before the pandemic, but I particularly ask it now because I'm curious, like how much of this is self-motivation and how much of this is a parent or a caregiver pushing it that way. Therapy is the least effective when it is forced on somebody. I have kids that come in and like, I'm only here because my mom told me I have to come, or I'm not really even sure what this is. I just, I was told if I didn't come, I couldn't play my Xbox, or I wouldn't get, technology or whatever. That's the least effective way to engage somebody into therapy. I like the idea of planting seeds or leaving breadcrumbs for people to kind of start to say very curiously to them, I'm noticing these things. This feels different for you. I'm worried about you. Is different than there's something wrong with you. You have to go see a therapist. I think kind of gently and kindly leaving these observations, these concerns out on the table. What eventually happens is they get picked up and they're like, okay, well, maybe there is something, maybe I will go talk to somebody. And that's usually when they end up coming into therapy. And I start to be curious. And oftentimes they'll say something to me along the lines of, I think I'm okay, but, my husband said this, or my mom told me that I've been this lately. And creating a space where we can be curious about that and start to try to understand that for them can lower that resistance to coming into therapy. It has also required me to get really, really creative. So I have a swath of teenagers I'm working with right now who hate teletherapy and don't like talking about their problems, which makes teletherapy really interesting. And so I'm getting really creative with these kids about like what therapy looks like. For one of my clients, she doesn't turn her camera on during therapy. And we just talk because she doesn't want to see her face and she doesn't want me to see her cry. I have another client that we have a shared Word document that we go back and forth with each other, and we just write each other back and forth during the week. And then when we're actually in the room together, she doesn't want to talk about any of those things. So we sit and color together and draw while we're together. But the therapy is happening kind of outside of that space, kind of more spontaneous. And so for people who are noticing loved ones struggling right now, not nitpicking or forcing, but kind of gently leaving that curiosity and those concerns out there is the best way to get somebody into therapy. And then it also matters the therapist they get connected with. For kids that are resistant or teenagers that are resistant, you have to be flexible in how you approach therapy with them. It will look different for that population as opposed to the person that comes in and says, surrender, waving the right flag, I'm done. And it requires out of the therapist a lot of patience, a lot of curiosity, a lot of willing to kind of forgo the treatment plan and work strictly on maybe some other things that don't feel like the main issue, but are as important to getting the person bought into therapy. Some of the kids I work with, the parents are involved. When you get past a certain age, they don't want their parents involved at all. And so that's a balancing act too, because parents really want to check in, or caregivers want to check in and know how their kids are doing. I'm having to say to some of those parents, like, if there's an issue, I'm going to reach out to you, I promise. But maybe right now they just need their space that's not yours. And some caregivers are really okay with that. And some caregivers are like, no, I'm so concerned. I need to know what's going on. Depending on the child and the age and the relationship you have with that person, depends on how much you can push and pull. And we just have to respect that right now. So there are some kids that are just barely hanging on. And I'm very protective of our safe space together, even from loving, caring caregivers, and trying to understand it's not personal, but like they're managing so much that maybe your involvement isn't as helpful as just being background supportive, if that makes sense.
The next question is, you spoke of survival mode. What are the characteristics of survival mode for adults, caregivers, and CASA volunteers? That is, how can we recognize our own symptoms and address them?
Yeah. So survival mode will look different for everybody. What it looked like for me was I disconnected from my emotional part of my being. So for those of you that aren't familiar with this, but I think if you've gone to trainings before, you've probably heard some version of this, where the left part of our brain is kind of our cognitive processing part of the brain, and the right part of our brain is our emotional, physical, spiritual experience of the world. For me, survival mode went into disconnecting from all of my emotions as much as I could, and just plowing through the next step of things. Okay, schools are shut down. Okay, I'm working from home. Okay, we need to figure this out. Okay, I'll squeeze all my clients into 3 days a week, and then the other 2 days a week, I'll be my son's school teacher. And like, just really not allowing myself to feel any of those things. And I think for me, I didn't fully notice how much I was in that until it started to slowly creep back up. For other people, you will start to notice that you're in that survival mode by your frustration tolerance level being really challenged. So things that maybe wouldn't have made you so frustrated before are going to be the straw that breaks the camel's back, and you're maybe yelling or more irritable than you were normally, and you just can't figure out why you can't function that way anymore. Problems with eating, problems with sleep, maybe increased alcohol use too. Maybe you used to come home from a long day of work and have a glass of wine, but maybe now you're having 3 glasses of wine because the 1 glass isn't doing it anymore. The problem with survival mode is that it really puts these blinders on. That's the purpose of it. It's to keep us hyper-focused and moving forward. You will start to slowly take that back over time. And I really encourage people to pay attention to that. For me, I remember several months ago, I was driving home from work, and this question popped into my head out of nowhere. And it was, am I in survival mode? And it wasn't a particularly hard day. There wasn't particularly anything stressful about that day. And I was like, ooh, that's a good question. And I went home and I took out a sheet of paper and I just started writing down all the things that had changed, either good or bad, just for, I think this was from January 2020. I think the question popped in my head in August. So for those like 8 months, I was like, okay, let's just start writing down all the things, good or bad, that have changed this year. I got to like 25 things and started to like have a panic attack and just put the paper away. And I said, yes, I am in survival mode. I have cognitive awareness that I am in survival mode, and have tried to slowly start to allow myself to feel some of these things. I had a friend the other week who just had like a full-on emotional meltdown that kind of took her by surprise, and she was processing it with me. And I was like, yeah, that was survival mode catching up to you. Like, there's all these things that we just haven't had the time and space to deal with that are back there. When you start to become aware to it, taking care of those things, using friends, maybe seeking support to kind of manage those things is so important. Or even just knowing that like that's where you're at, me being able to recognize like that's what I was in and was helping me actually lowered my level of anxiety about being in survival mode. I was like, okay, it makes sense as to why I can't deal with all these things right now. And it actually allowed me to get curious about what I needed to be as okay as I can right now. But yeah, the biggest one is really just disconnecting from your emotions. And if you're just kind of going through the logistics of the day, that might be a really good sign that there's some emotional things that you're not necessarily processing or dealing with.
Made it through the whole webinar before I spoke with being muted. I want to thank Paige for her continued willingness to share her time with Piedmont CASA. It's a great resource for us as an organization. And as most of you know, she avails herself to the organization and is willing to speak with anybody who needs anything or future trainings. Our next close to home webinar will be March 16th at 10 a.m. And we have Jay Chowdhury from Albemarle County Department of Social Services. And he's going to speak to strategies for parental engagement on how best and some new methods that they are using at the county to improve their engagement with families in general, but particularly fathers. And some of you may have heard him speak before on this topic, but I thought it'd be a great resource for us to continue the Close to Home series. So I want to thank everybody for attending, and we will see you guys at the next session. Thank you.